Good afternoon and welcome to the 82nd of the COVID calls. This is a daily discussion of the COVID-19 pandemic with a diverse collection of disaster experts. My name is Scott Gabriel Knowles. I'm a historian of disasters at Drexel University in Philadelphia. Today, my guest is Scott Miles. He's the research scientist in the Department of Human-Centered Design and Engineering at the University of Washington and director of the Impact 360 Alliance Initiative. You can catch COVID Calls live every weekday at 5 p.m. Eastern Time on YouTube. Just go to the COVID Calls YouTube channel to watch. You can also watch COVID Calls on Facebook Live and on Periscope. I'd like to also welcome new viewers and listeners to COVID Calls. You can hear COVID Calls anytime recorded as podcasts on Spotify, iTunes, Podbean, or anywhere you get podcasts. If you're wondering what COVID Calls is all about, be sure to check out our introductory episode on Podbean. It's also linked on the Facebook page. You can also keep up with COVID Calls via Twitter using the handle @US of Disaster or @COVID Calls. Please do help spread the word and send suggestions for guests and future topics, and please do feel free to suggest yourself as a future guest. I'd also like to give a special shout out to all of my colleagues who are participating this week in the 45th Natural Hazards Workshop. Please check it out and follow them using hashtag HAZWS, that's HAZWS on Twitter. As of today, July 14th, 2020, there are 13,177,855 confirmed cases globally of COVID-19, according to the Johns Hopkins University Coronavirus Resource Center. That's up from 12,988,624 cases yesterday. Of those, 3,397,069 are in the United States. That's up from 3,336,154 cases reported yesterday. There are now a total of 136,117 deaths reported in the United States from COVID-19, up from 135,425 reported yesterday. As a way to bring humanity to the numbers, I've been reading a life story or a story of advocacy for COVID-19 sufferers every day, and I'd like to continue that now. The headline is Texas' first coronavirus-related death was a 97-year-old Bay City funeral home director. The author, St. John Barnard Smith. This was published March 17th in the Houston Chronicle. Eddie F. Roberts spent decades burying Matagorda County residents, one of just a few morticians in the rural county in southeast Texas. No more. The 97-year-old Bay City resident died in March, the first Texan to succumb to COVID-19, the disease that has swept across the globe, sickened millions, and brought the global economy to a virtual standstill. In Bay City, where his mortuary has served local families for the past century, the news was a sharp reminder that no area, no matter how removed, is immune from the pandemic's reach. This has hit home, said Matagorda County Judge Nate McDonald. We're socially distanced. We felt safe until that point. The first case emerged after a 60-year-old woman tested positive for the illness. Then a 97-year-old man, later identified as Roberts by employees of his funeral home, went to the hospital for pneumonia-like symptoms, according to Aaron Fox, spokesman for the Matagorda Regional Medical Center. Hospital staff didn't initially test Roberts for coronavirus because of strict government protocols that required patients to show they had traveled or had contact with someone who traveled, Fox said. After that criteria loosened, the mortician was tested, Fox said. It's not clear who contracted the illness first, he said, adding that officials believe the two cases were linked and the result of community spread. Like anywhere else in rural Texas, a lot of people are putting their backs into the response, said Mike Riddell, editor of the Bay City Sentinel, one of the two newspapers that serve the city. The speed with which the pandemic had hit this small southeast Texas county had still come as a surprise, he said. A week ago, and this was reported in March, they were planning the pandemic response, Riddell said. You don't think of it actually striking. Now we're in the midst of it. As the Duncan Roberts' funeral home, the doors were locked, adorned with violet ribbons. Roberts had spent decades running the funeral parlor, which was established in 1920. An arsonist destroyed the building in 1992, but Roberts rebuilt on the same site, neighbors said. The undertaker married Faye Roberts, a teacher with Bay City ISD. The couple celebrated their 50th anniversary in Florida in 2001, according to a story in the Victoria Advocate. Faye Roberts died in 2016 at the age of 88, according to her obituary. Residents describe Roberts as a fixture of the community, a man who helped a lot of families in their most challenging moments. Now he was gone at a hard moment for the community that seemed protected from troubles sweeping more populous areas. This popped up on us overnight, said Larry Fields, a neighbor. They were saying it was nowhere on the coastline. 2 days later, someone caught it. And then 2 days after that, someone died. Okay, I'd like to turn to our discussion for today, and I'm really excited to bring Scott Miles on. Really eager to speak with Scott over these past few months. Really glad to get him on today. Let me introduce him. Scott Miles is a disaster scientist and consultant with expertise in disaster risk reduction, long-term recovery, community resilience, reconnaissance, simulation modeling, information systems, and human-centered design. He is a senior research scientist in the Department of Human-Centered Design and Engineering at the University of Washington. He is also director of the Impact 360 Alliance Initiative, which is a collaborative of the University of Washington, the University of Oklahoma, and Impact WX. Scott was previously an associate professor at Western Washington University, where he co-founded the Resilience Institute and Huxley College's Disaster Risk Reduction Minor. He has degrees in civil engineering, geographic information science, and human geography. Scott Miles, welcome to COVID Calls.
Hey, Scott. Thanks for having me. Excited. By the way, thank you for doing this. You are absolutely tireless, and I want you to know the community really appreciates the work you put into COVID Calls.
That means a lot to me. Thank you for saying that. This 5 o'clock hour has been, I guess selfishly I'll say it's been an hour I look forward to every day, and I really look forward to our conversation. I want to remind people you can get your questions in for Scott Miles. Just put them right into the YouTube live chat, or you can also email me directly. Some people do like to do that. sgk23@drexel.edu, or you can just put them up on Twitter and just be sure to tag @USofDisaster. So. Scott, I'd like to start the way I've been starting these and just find out where you're calling from. And it's, I think, a new location for you, and find out what the COVID-19 situation is there. And then maybe we can talk a little bit about if there is some social justice issues going on there, what you're seeing there with that as well.
Yeah. My wife and I moved to College Station, Texas, 3 weeks ago. For those that know me, I'm still employed by University of Washington. My wife is pursuing a veterinary radiology residency, and she starts tomorrow. So that's what got us to College Station. We were in Houston the last year for her internship. So, like, what I can tell you about College Station, pretty fresh to Brazos County, but I can speak to it a little bit and speak to Houston quite a bit more. I mean, I think from just an anecdotal perspective, when we first started looking for our apartment and first got the keys to the apartment, we were the only people wearing masks as we were walking around. And that was kind of like, you know, that cognitive dissonance is like, we want to fit in, but at the same time, we want to do what we felt was right. And, when the city of College Station, well, what was it? San Antonio figured out how to get through the loophole. If you have businesses require masks, then apparently that is okay. That for the governor, and Bryan and College Station did follow suit after San Antonio did that, and we were certainly wondering, is the trend going to continue where we'll be the only ones wearing the mask? And I actually really happy to report that it's pretty rare that you see anyone not wearing a mask around here. So it's expectation I had is that we would have a little bit of that culture clash, and I'm sure it's happening. And if you know the area we're living, like in the Northgate area, so maybe that's a little bit different than on the like unincorporated areas. But really happy with how people have responded to the new ordinances in Bryan and College Station. Houston, of course, is a whole nother thing. Like I moved up here before Kristen did, and it's kind of like, oh, she got out just in time, and it's kind of a sad story, right? Because it was a bit of a success story before the state was opened up so quickly, right? I mean, like Lena Hidalgo, 29-year-old executive or judge, I can't keep that in my head for Texas. You know, she already dealt with Harvey. She dealt with a lot of explosions. She did it in a very graceful way. You have Mayor Shaw, who's like one of the more famous public health officials, particularly with respect to disasters. And like from my just reading the news perspective, I thought they were doing a great job, and they clearly had a plan, which of course had to change every day as situations changed. But then, you know, they got a little handcuffed, and that's where the story becomes a little bit of a tragedy, right? That you have these officials, this executive that did have a plan, whether or not it would have worked, who knows? But it was working at that point, and then just being handcuffed, and then not having the tools now at their disposal to continue to work on it. And it's kind of like the cat's a bit out of the bag. So we'll see what happens.
And the thanks for that update. And even thinking about that sort of importance of the distance between Houston and College Station is important. And I suppose we'll talk a bit later about these issues that come up perennially, I guess, between, you know, these are federalism issues. And I talked to Don Kettle a few months ago about these, and we often think about federal state issues, and maybe we don't talk enough about sort of within states, sort of like state to county level kind of issues. Let me also get an update from you. I know you're recently arrived on the campus, but what's happening in College Station on the social justice front?
Yeah, I wish I could report more. I'm proud to say that I've figured out what the local newspaper is, and like I told you in the green room, I'm excited there is a local newspaper in College Station. So, you know, I can only really say that I don't know what happened soon after the George Floyd murder, but I do know that on campus, Texas A&M University campus, there are students. I think daily protesting a particular statue who I've forgotten who it is, and I think wanting to tear it down. So I think, you know, within the city, within the county, it's not super noticeable for me right now, but I do know that there's conversations and action happening on campus.
So let's start. So many issues to talk about with you, but let's start with Impact 360 Alliance. Is something I know a little bit about. I was fortunate enough to be part of the discussions that helped to form it, and I'm just thrilled with what you've done with it, and need an update. And I'm glad that the rest of the community can get an update from you at this time. So what is it? What are you up to with it?
Yeah, you should tell me when it started. I mean, the idea happened, I think it kind of came from multiple different directions, but just so folks know, it like far preceded my involvement by 5 years, 4 years? It was, I think the idea was kind of came out, or at least was published in this Living with Extreme Weather report, and this idea of needing to foster integrative approaches between different academic disciplines, but then obviously with the goal to get research into practice or research into operations, so involving practitioners as well. And a large group of you came together, put together a working paper with kind of the large concepts and what ultimately was the charter that led to the steering committee that you were on, that found the director, who is me. And what it is right now is a little confusing for folks, but we'll take the confusion out hopefully in 6 to 9 months. So it's an initiative of the three organizations you talked about: University of Washington, University of Oklahoma, and Impact WX, we are not an independent organization right now. However, we have incorporated a business in Delaware and have submitted the paperwork to the IRS to get the tax-exempt recognition, 501c3. So the idea is right now we have 4 staff at University of Washington working on the Impact 360 work. And then whenever we get that recognition from the IRS, we are going to transition to being an independent nonprofit organization. So that's the technical details, because people always kind of ask me like, oh, if you left University of Washington or things like that. So this is technical details. In terms of like what we do, who we are, so we're developing process tools for researchers and practitioners to strengthen their connections with each other, to integrate their work, their approaches, and ultimately inclusively solve problems together to reduce the impacts of natural hazards and disaster risk. And so we do a lot of things. We're a member-driven organization. We kind of launched that about 3 months ago. So if you haven't joined Impact 360, please do. You can go to our website, impact360alliance.org. And so we offer a lot of member services. We can help you find researchers and practitioners to put together teams for projects. We offer a lot of planning services to help you scope how you would do kind of that integrative or convergence work, whether it's in an NSF proposal or some kind of internal initiative. And then we also offer facilitation, coaching, and training services. So we are trying to develop a business model where we have a portion of our financial sustainability funded by income generation, so the service-based stuff, just so we have a little bit of diversity. So hopefully we'll have some financial sustainability going forward.
This is something you and I have talked a lot about over the years, and I know it's something that, the hazards meeting is happening right now. I'm sure there's discussions, even though we're doing it virtually in the virtual hallways, people are having this discussion. How do we get what's sometimes quite esoteric research, very empirical, into formats that we can then push out into policy avenues, but also into the hands of practitioners. And it's often spoken of in a frictionless way, just we have these great ideas, put them out there, and the world's going to pick them up. You've got a lot of experience with this. I know it's what Impact 360 partially is about. What have you learned in doing this job in this time about challenges with that, maybe things you hadn't thought of or you didn't realize were going to be as hard to tackle as they are?
Yeah, there's a lot there to unpack. I mean, I'll say when I was appointed director, I had around 100 conversations with academics and practitioners in different types of agencies and private sector. And it's funny, what you hear from people in these private conversations are a little bit different than when you hear with people sitting on a dais and talking in a panel or a Q&A like that. And that really influenced how we started scoping what Impact 360 is going to do versus like what was in that original charter document, which was vast. And one of the big insights was that there really was a focus on and the need for problem solving more so than communication, right? So this idea that, it'd be great to learn this or that, and we do have questions and we can have difficulty finding that answer because there's the paywalls and we can't access journal articles, and even if we could, we can't understand them. But what we would really hear from practitioners, I should say, is they actually wanted collaborators to work together to solve problems, whether there's a small problem or a big problem. The way that we heard they really wanted was to interact with those folks, right? So the other thing that I learned was that cultural gap in many instances is as bad or worse than you do hear about the adjectives that people used about both actual people and kind of like archetypal archetype people sometimes surprised me. And so that was where we're like, okay, we want to focus on problem solving, and we really want to focus on building capacity for people to work together. And so we have this framework we call the convergence pyramid. This idea, it's kind of like the Maslow's hierarchy of the kind of capacity building work that we think we as a community need to do. And the foundation is connection, right? That we find each other who shares similar problems, expertise, situations. And then you move up to communication, cooperation, coordination, collaboration, and co-creation. And the point of all those C's in answering your question is communication is not enough. It's not nearly enough. So and it's not necessary that you have to learn to communicate to be able to co-create. These are just different levels of commitment, right? So there are actually instances where we could co-create together, and the knowledge from the different folks in the real or virtual room could be, kind of activated to understanding the problem, generating solutions without, conveying those facts and figures from one head to another. But there would be other times that we do need to facilitate that communication. And if you're curious about what we've learned about that, I can tell you. But what was really important for me is there's been a big focus on the practitioner side for the problem solving, and to have that be successful, we really need to build capacity for us to do convergent work together.
Let me stay with this a little bit, and maybe for people who are less familiar with the kinds of problems that practitioners might be bringing to the table, can you paint a picture for me of something that's on your agenda?
On our agenda, I don't know about on our agenda. I mean, I will tell a little bit of an origin story, and for those that know, I'm gonna butcher it. So we'll call this a cartoon of our origin story. But this idea, for example, that researchers are working on weather forecast models, and what those models are capable of far exceeds what's available to the general public or to broadcasters, right? And there is this question of how do you get that, or when do you get that, research into operations, into practice? And so this is something that NOAA has struggled with mightily. They're the only federal agencies that has this idea of readiness levels. I don't remember if it was on a scale of 1 to 9, but after you conduct some research, you have to file this report where you describe which readiness level. But that still makes it quite difficult, especially if you're a social scientist, to translate that kind of into a decision of whether this is ready for operations or practice. So that is just a generic example. I actually tried to take out names and organizations in there. I would rather not specifically talk about folks that we're setting up work with, because I have not asked them if that's okay at this time.
Sure. So the other thing I wanted to ask you about with that, and it's something that I think any of us who are interested in this kind of work find, is that the motivations are often disparate. So, if somebody's working in a federal agency, or they're working in a county agency, and they're working in a municipal office of planning, or maybe they're an academic, they would share, if you put up a sign and say, are you interested in driving down disaster deaths? They're all going to come to that table. But their individual career motivations and how they keep their jobs are pretty disparate. And I can imagine you knew that going into this job, but that must be a constant challenge. I want to ask you a bit about that. How do you find a common currency for people to come together to really give their valuable time to work on these kinds of issues, knowing that for some, it's going to be a plan that's going to go before city council, and for others, it's going to be a peer-reviewed paper, and it can't just be one deliverable, can it?
Yeah, I mean, there's two threads that come to mind with that. I mean, a common question with Impact 360 and talking about it with others that we get is, researchers and practitioners, what do you mean by that? Am I a researcher? Am I a practitioner? I feel like I'm both.
Mm,
But your list doesn't
yeah.
include anthropologists. Do you also like support anthropologists? So we always get the what about, but what about these folks? And our answer usually is yes, in terms of supporting folks, the way we talk about it. So we're like a meta organization. We're like the BASF for those old enough to know. It's like we don't do the work. We're working to make your work better, right? So we're not so concerned about identifying folks that work on disasters. Y'all self-identify as working on disasters, and if you're not paid to do it, maybe we'd make a little bit of a judgment of like, are you volunteering a good chunk of your time working on disasters, whether you're a community organizer or something like that. But it's really not our business, Impact 360, of trying to judge whether you are a bona fide disaster professional, whether a researcher or practitioner. So that's the high level thread. The lower level thread is, having people come together. A little bit of a broken record, but an important one for us is that it's the problems that bring people together, right? So we are focused on fostering kind of these problem-focused communities, problem-focused teams. And so if individuals want to solve a particular problem, we do think they'll either find a way or they'll find someone to help them find a way where they can work together. And that's where the motivation is going to come from, right? I mean, a cartographer would have never gotten together with a database designer had they not had a specific problem to bring that together for GIS. That's not quite how the story went, but as an example, right, it's got to be problem focused.
I see. Well, thank you for that description of what you're doing with the Alliance. And I want to remind people you're listening to COVID Calls. I'm talking to Scott Miles. I want to transition over now to talk with you a bit about COVID-19. I follow you on Twitter. I keep up with your thoughts, at least as they're described there. And I know you think a lot about science communication, and I know you think a lot about this community of researchers and the way that they communicate. On Sunday, I had the opportunity to participate in a science communication workshop with colleagues, and Ksenia Chmutna and Jason von Medding. And it was really wonderful set of conversations that we had there. It was sort of a training. And there were 100 people that showed up. I mean, the interest level is very high. I mean, I think we as a community do want to communicate, and we want to communicate with media. We want to communicate with policymakers. So let me get your sense of it right now. I know you're following things pretty closely. How is the disaster research community, broadly defined, doing in terms of translating our knowledge for people in the world, journalists, who want to know what we can contribute to this COVID-19 discussion?
Oh, yeah. I mean, first, just a caveat with Impact 360 Alliance, at the moment, we do have kind of a boundary where pandemic, kind of those issues fall outside the scope. And
Sure.
We also don't chime in on specific subjects. We're more of a meta process-oriented organization. So I am definitely talking as Scott Miles, research scientist at University of Washington.
Okay.
They might
Good.
regret that as well. The question about how well our colleagues are doing at communicating, I'm not even going to touch that, right? We're just too close of community for me to say. Not to mention, like, I don't have the full picture. This is a very unusual situation where the way we're hearing about what each other is doing is through Twitter, right? I'm actually a little anxious about this conversation because this is literally going to be the longest conversation I've had about this topic. My wife and I talk about it, what's in the news, but it's not this kind of conversation, right? So my awareness is not what it usually would be if it was like related to, earthquake in Mexico City or something like that. So what I will say is that, hey, I'm like really happy that see so many colleagues willing to communicate, right? That's not always been the case. And maybe it's a little generational thing where I think there's more willingness to engage with like media and public platforms, or maybe it just feels like this is the time. So that is great. And the key to communication is to just start doing it, right? And not worry. It's that improv principle of just jump right in, right? You're always going to make mistakes. So you might as well get in there, right? If you have that core philosophy of doing it, which again, I'm glad our colleagues, more and more of them do. If I was going to offer some constructive criticism, I think there's been times where I felt maybe some folks should pass the mic. I will say outside the context of pandemic, just as an example, because I can survive people reacting to this. Like a seismologist. The seismologists, like if people don't know, I come out of the earthquake world. Seismologists are sexy. They may not realize it, but they're the sexy ones, and that's who the media goes and talks to. And they get asked questions that are far outside of seismology. And the best thing to do at that point is to say, that's outside my wheelhouse, or offer some high-level things. But most importantly, talk about specifically or generally who would be good to talk to, either a recommendation or to actually say that in the interview. And I think there's been times, and it's often, between kind of the natural scientists and the social scientists, I think there has been times where I think the mic could have been passed. I don't know about you, but I typically do get a lot of interview requests, and I turned down every single one of them this time, every single one of them. And I passed the mic to someone else because I was like, this is so far outside what I've worked on, what I've read about, who I interact with. Like someone asked, like, oh, you're a recovery expert. Can you do an interview about what recovery is going to look like related to the pandemic? And I'm like, no. I'll give you some suggestions of other people to talk to. I wasn't sure if they should pass the mic or not. But so that would be one piece of constructive criticism. And I think the other is, this is hard on Twitter, but in terms of other forms of communication, try not to oversimplify, actually. And I think there's times where in the effort of trying to communicate what's obviously complex work and nuanced findings, we actually do oversimplify, and that has its own problems, right? And so for me, I would maintain the level of nuance, but try to do your communication in a more kind of empathetic, inclusive, inspiring way so people could connect to it.
Let me, on that second point, there have been a couple of issues that have come up. I think they always come up, but since this disaster is so ongoing, they keep coming up. One has to do with panic, and the other has to do with pro-social activity. Do disasters inspire, nature red in tooth and claw, or do disasters inspire pro-social behavior? And those are both issues where I feel like disaster research, particularly social science disaster research, has offered important correctives historically to easy sound bites, easy headlines. Mm-hmm. The world's going to fall apart. Everybody's going to loot their local Walmart. And yet at the same time, empirically, what we're seeing right now is challenging to those. Panic is not a word that means everything in every context, and pro-social is also one that if you decontextualize it, it might mean something, but the minute you begin to talk about a global pandemic, what are you talking about with pro-social? I don't know if either one of those resonate with you, or if any of the other sort of traditional areas for social science disaster research, you felt like, again, to your point about nuance, don't undersell the complexity of the research.
Right.
Either one of those stick with you?
Yeah, on the topic of panic, like here's me passing the mic and then adding a comment on this side, because this is like, I've read that stuff because of my educational upbringing around disaster science, but it's not a literature that I'm well versed in. But my observation has been that how would you say, more here's anecdotal. So I'll see a lot of disaster researcher. I saw a lot of disaster researchers in the early days when starting to get exponential growth in the United States for COVID and the whole toilet paper thing, like putting out there, people are not panicking. They don't panic. That's a disaster myth. Okay, it's true in some contexts, but I actually was kind of curious. Well, I should say, by the way, so Quarantelli defined panic as a asocial thing, right? So there's nothing that says that in a span of time that someone can't be asocial and prosocial, right? We are complex beings, and there's a lot of time to switch between asocial and prosocial behavior. And so I was kind of curious, like, what are the psychologists doing right now on this topic of panic? Because obviously this is all throughout the media, and they were reacting in a much different way. They weren't saying, this is a quasi law in our discipline, people don't panic. They were using that as a chance to explain what was going on, kind of questioning whether this is a different situation. And I think as researchers, we do owe it to ourselves to say, in the past, we have evidence where, as this example, but not specifically, because there's other examples, panic has not tended to occur. But we do need to have that open mind now. That was that panic, right? So I don't think that those early days are the time really to be just stating those myths. And that's just my perspective. And like I said, that's totally an outsider perspective, having done no work on that particular topic. I mean, it's more.
I think that
topic.
Yeah,
it's more of a science communication insight. Yeah.
Yeah, I think it's interesting too, and it's something we talked about in the science communication session on Sunday. And to your first point, that having some trust between journalists and researchers is important, and it's hard to build that in the moment. This is like something I think it's kind of a broader challenge for the community. And because we worry that if we get asked a question as a researcher and I'm going to say it right the first time, and I only get one chance to say it, and that's it.
Right. Yeah,
right. And you're talking about passing the mic, and so we worry, like, will the journalists take that? Are they give a couple of names? Are they going to actually follow up with those folks?
And in the several, I mean, I probably passed the mic nine times or so since the growth of COVID. And I did follow up with colleagues a couple times, and I will say most of those instances, they did not get contacted. So your concern is warranted.
Yeah, I think it speaks to some work that we still have to do about finding some ways to signal to journalists and science communicators that we're a big tent and there's a lot of people in it. And when we pass the mic, that it doesn't have to be so specific. You contact this person, but that there's a sort of broader community of people.
Yeah, exactly.
To reach.
And to your point about the relationship building, I mean, it's absolutely true. So most of my inquiries are from the Pacific Northwest of journalists, or at least outlets that I already had a relationship with, right? So if you do suggest someone else, or you do suggest kind of a different discipline, but they are unfamiliar or inaccessible to those reporters, I mean, it's not surprising that they're not going to actually reach out.
I want to remind people you're listening to COVID Calls. I'm talking to Scott Miles today, the director of the Impact 360 Alliance and professor at the University of Washington, a real disaster polymath. And I want to stick with this discussion a little bit about communication, but now talk about these dashboards. I know it's something you're following that as well. Have you been surprised that this particular disaster, this pandemic, has been represented so graphically and interactively? I've never seen anything like this.
Surprise. So those conversations I was talking about in the early days of me being appointed director to Impact 360, and actually, there's some folks like Nanya Campbell helped me out with this. Like when we talk to researchers and practitioners, this is a total oversimplification, but like what we often heard was problem solving on the practitioner side. Like we want to work together with people to solve particular problems. That's the support we would love from a new organization. And a lot of the researchers, particularly the academics, were like, we want support getting our data out there, web maps, dashboards. It's like very, very different needs and kind of assumptions about how that kind of communication and integrative work would happen. So in terms of like that core need and motivation, that's not surprising to me. But in terms of the scale of what you're talking about, no, we've never had anything like that. So with the geovisualization, the data emphasis, the big thing, right, is that like modeling, computer modeling, scientific modeling is now like part of the public discourse. The only thing we really have like that, of course, is weather forecasting, and even that. I mean, the savvy folks like in the Gulf Coast know their different like models and the spaghetti models, but overall, people are not familiar with the models. So, I mean, just that scale of all three, that was totally unexpected for me.
What are you thinking about with that? I mean, I think the weather forecast is like an interesting proxy. Like your average American, let's just take people in the United States. You think they're better able to make decisions or assess the behavior of the public health officials when they can interact with these models? Or do you think, I guess this shouldn't be an either or question, but how does that shape the way that they also then think about policy? And I know it's early days to think about this, but I feel like we're really at a turning point here with this new way of people to gather data. I've been thinking a lot about our Cold War antecedents, and you go back in the archives and you look, and civil defense experts had a lot of, they wouldn't have called it a dashboard, but they had a lot of kind of similar data presented to them on a regular basis about sort of like forecasts of what would have happened with nuclear attack in various cities. I didn't see much indication it helped them make good decisions, but they certainly were informed in this way. Maybe it's not a great proxy, but it's been on my mind. What do you think about this in terms of?
I mean, so that's core of what I do, and since I haven't done anything specifically research-wise on that, it's hard for me to say. I mean, my gut says that they like these dashboards and the reference to like the Philadelphia, the IMHE models, like it really hasn't helped the public specifically. The whole flatten the curve thing, while that's not specifically around data or models, I mean, it's kind of around models because that's what we started looking at, is like we were visualizing the models as these curves. And it was this like amazing achievement from a science communication standpoint that we got the public, the media talking about flatten the curve, and somehow this became part of the vocabulary. I mean, that's an amazing achievement, and I think it was totally misguided. It's like, so we could have just said like slow the spread so we don't exceed the capacity of our responders and hospitals, and that would be something that people could operationalize and that they could understand how things might shift and adapt. But with the curve thing, you've got them to understand what you meant by flatten the curve. You were able to show your like scientific plot and create animations of it, but you actually didn't provide enough context for like the general decision makers to think further about it, in my opinion. So that is an example where those kind of things, those kind of artifacts, dashboards, models, I have a view that is not shared by that many folks. They literally are facilitators. They're like a co-facilitator in the room, like a normal human facilitator. They are there to help facilitate a conversation. That is the only role for those kind of things. And so just like a facilitator has to really think about how you design the process in which you engage people and have that conversation, well, you have to do the same thing with data dashboards or simulation models. Otherwise, those that like the public decision makers, electeds, like you can't have very high expectations for them, right? It's the same as like if you just walk into a conference room with no agenda, no experience facilitating, and then wonder why the meeting turned to chaos. So for me, that solution, like you have to take a much more human-centered approach to designing all those things. But I mean, you have to design it from first you have to design it, which I don't think in many cases people were designing. It's kind of like, oh, there's this Esri product. I have some data. Can I get it inside that Esri product? Publish, right? There wasn't a lot of design for that. They didn't identify a user. They didn't identify a need. And they didn't iterate to see if what they put out there would actually meet the need. And they certainly didn't do any kind of rapid testing. And I think a lot of our colleagues are like, oh, that's so much work. But this happens very, very rapidly in a lot of industries as it is. So we can learn from them in that case. That's no longer science, right? Getting a dashboard out there, getting a model like a GeoViz interface for a model, that's no longer science in that context, right? Because you're trying to get that out fast and fit for purpose. And there's a lot of other industries we could learn from so that those tools are more effective. So for me, it's more evaluating the folks that put out the dashboards and put out the models than at the moment worrying too much about the public. I think it's great that there is enthusiasm for it. I think it was an achievement that there was an appetite for it. But I think now, on the research side and the practitioner side, they were often responsible for it. We need to kind of huddle up and say, well, how would we do this in a human-centered, fit-for-purpose way next time in the next disaster?
Right.
Yeah.
There's a comment here from Amy Slayton, and it's a really nice comment, I think, about this idea that the science wars are just below the surface here, and these models persuading people except when they don't. So they're not, and I really like your point about somehow we quickly got people to rally around this sort of flatten the curve idea, but that maybe that was the wrong rallying cry. Is it possible, again, to change course, though? This is not Hurricane Katrina. This is not, or a flash. This is not, turn around, don't drown. I mean, this is a pandemic that's going to be ongoing at least until March and probably longer. Can these dashboard creators and the publics that they serve find a place to interact?
I mean, for me, that's not the question, right? I mean, the question is starting with what's the need, and then let's design a solution to meet the need. Let's not, the whole hammer nail thing. Like, like for me, it's like, oh, it's so easy. There's so many people. It's like so easy to create a web map now. It's so easy to publish my data. That's not really the right question at the moment. But if you establish that need, then yeah, that's the right question, right? But the first question is, what is the need for who? And so I'm not too concerned about whether we can improve, the communication of simulation models, computer models, or improve these data dashboards until you can show me that there is actually specifically a need that can't be met with something simpler, than a
okay.
Yeah.
Okay, I'm not going to call you a Luddite, but I do like the direction that you're going there and sort of thinking about the deeper sort of social need that we have to talk about before we fall in love with the techno fix.
Just so you know, though,
we've had similar discussions.
Just so you know, though,
go ahead.
2 bands ago, I had a band that I created called King Lud. So go ahead. You can call me a Luddite. Then I'll tell you what it really means.
Yeah, for people who are not familiar with King Lud, you can easily do a little research and find out what that's about. I want to remind you, you're listening to COVID Calls. I'm talking to Scott Miles. Please get your questions in using YouTube live chat, or put them up on Twitter if you want to, or you can email me directly, sgk23@drexel.edu. Scott, I want to talk to you about another topic, and it has to do, I guess, with professional boundaries to a certain extent, because I know you think a lot about this. And something that has really impressed me, there was much more press about it in the last couple of months than more recently, but I think we're going to see it again. And it had to do with the potential impact on pollution and climate change with all of the staying home that went on, particularly in other parts of the world and in the Northeast in March and April and May. And those were important, I think, findings. We did bring greenhouse gas emissions went down, certainly, but was that remarked upon by emergency managers enough, or what were the boundaries of sort of like who should take those as important data points and who shouldn't in your mind? Because I saw that being discussed among people who self-identify as like, I'm in the climate world, but I didn't see that as much in the emergency management world. And I'm always thinking about those boundaries. And I know some of our colleagues like Sam Montano, for example, is thinking about these boundaries as well. What are your thoughts on that?
Many. People don't know my hobby is cities. So that's what I spend more time on Twitter talking about. But I think there's like two sides to this idea of air pollution, and particularly particulate matter, right? Kind of exists in two spaces for us. It's like the kind of the impact and recovery space, right? So which is what you're talking about. During social isolation, you saw emissions go down, you're seeing them go back up. I did not see many academics, many emergency managers talking about Build Back Better in that context, or whatever Bounce Back Better. It's fraught with the issues that we've identified, but there still is a place for this conversation about how can we recover in a way that maximizes well-being in the long term. And that literally was one of the most central issues then on the vulnerability side, right? So much of the comorbidities was related to particulate matter. And those comorbidities are driven by racism and white supremacy, right? And we are not talking about like those kind of environmental racial justice issues in the emergency management and disaster research space that this provided the opportunity for, right? And so that is why you would think, oh, we're bouncing back better on what? Particulate matter, because it was so core to how people were impacted by COVID. Well, where is that coming from? Well, it's coming from the kind of the environmental and land use decisions that are born out of a white supremacist approach to land use siting. And that was a great opportunity for all of us in our community to like bring it back to that, right? As this idea of bouncing back better. So yeah, the issue of pollution and particulate matter for me, as you can tell, is a bit of a hot button. I don't understand why that you're talking about the boundaries. Why is that outside the typical boundary, pollution, particulate matter of emergency management and disasters, when we talk about so many other aspects of susceptibility and vulnerability, right?
I want to go a little bit further with this on you. Do you think so I'm a historian, so I'm always thinking about temporal boundaries. So the way I come at this is that it's like, well, emergency management has staked out for itself a very near-term temporal space, but not always. I mean, I've talked to a lot of emergency managers who know disaster history as well as I do and have ideas about possible resilience that go very long into the future. So maybe those temporal boundaries aren't correct. How are you? This is, I guess, a perennial question, but I want to talk to you about how you see it right now in this moment. What are the factors that are keeping emergency managers or disaster scientists from thinking about things like climate change, or as you talked about this particular issue, particulate matter, let's say?
Yeah, I mean, so let's tackle the climate change thing. It's like talking about climate change, or we need to mitigate climate change, or we need to think about adapting to climate change. Why are we still talking at that level, particularly related to the pandemic? Like, let's get down further to understand what's driving that vulnerability. And what's driving that, for those that were used to talking about the PAR model from Cannon and Wisner and Blakey, I mean, that's like the dynamic pressure, right? Well, what's the root cause of that? It's racism, right? It doesn't take you many steps to get down there. So climate change, yeah, but that's obfuscating what's really going on in the case of this pandemic. And I don't have a full answer for you of why we haven't, as a community writ large, gotten down to that level. I think some of it is like for emergency managers. I mean, they got shit that they're dealing with right now. There's an immediacy that makes it very difficult for an under-resourced like group to be worrying about. For academics and disaster researchers, you know, I was very disappointed to see the research agenda that the NARI Converge group put out. Whereas over 20 research questions related to the pandemic, and not a single one dealt with that dynamic pressure of particulate matter, and not a single one had a question related to the roots of racism in creating the vulnerability for COVID. So I just wonder if we're still not to the point where we can have those conversations, because I think on these issues, it's going to have to be the researchers that do offer some leadership. And for that research agenda, I didn't see it.
Let's switch to that then, or connect to that. This discussion about anti-racism, of course, has come up in discussion of policing. And if we think about the different offices in City Hall, you know, we have the police commissioner, and obviously the reality of what the murder of George Floyd and everything that connects with the present and the past falls there. Is the emergency manager's office implicated too?
Is it implicated? The office, I wouldn't say any particular office is. I think, you know, the general approach, and I know you were asking this question because it was a series of tweets that got a little bit of attention, but that common approach of doing the most for the most, you know, trying to provide the most benefit to the most people in the shortest amount of time will always wind up putting white people first, right? And for me, the primary goal of disaster work and emergency management within that should be make disasters as equitable as possible, which I think for a lot of folks sounds awfully weird. So I'll say it again. Our first goal should be to make disasters as equitable as possible. Otherwise, I do think that there is a systemic racist approach to that and doing the most for the most, right? And that's a big culture shift for all of us to be saying, well, our primary goal might be to use the resources we have and it won't benefit the most. It won't even benefit close to the most.
That's, you know, thinking about that with you, about how that might even change the nature of what we call disaster science or emergency management research is really profound, because it does force us to think about lots of things. Obviously, how power is constituted, also how the academy is put together, who we write to. I mean, part of this to me is structural on the research side. If you put forward a grant to the National Science Foundation where you want to examine structural racism in the most for the most approach in emergency management, do you think that would get funded?
Yeah, I mean, so I was actually on a call and heard an anecdote of a particular PI wanting to ensure that there was an anti-racist goal explicitly laid out in their proposal. And there was concern that using the language of anti-racism would not review well. I don't know if that's true or not, because it's all us that would be on those panels. But the fact that there is that concern is troubling. And so some of us have to start doing that if we want to achieve those anti-racist goals. And I think we need to be careful not using, general terms like vulnerable groups, racial disparities, because it is hiding what's most important to ask right now, which is, how does racism finish the question, right? It leaves too much room if we're using these more generic terms. And I think we just have to start having those conversations. We need to start putting those research questions out, and we'll see how the review panels respond.
I just want to tie that back to our previous discussion about the dashboard. And I know it's kind of putting you on the spot, but you're up to it, which is, if you were going to reimagine how those dashboards could work and also move into this kind of anti-racist space, or as you say, getting down to the question, can we really get down to the question? Could you see that kind of how can we begin to talk about that? How can we begin to talk about not letting go of the possibilities of new technology and new findings, but also attacking old perennial problems? I mean, you mentioned earlier in our discussion that there's a statue on campus at Texas A&M that people are worried about. Those histories are there. They're long-standing. Those are old problems. We don't need a data dashboard to tell us that Jim Crow was alive and well in Texas. How do we bring those two together in some way?
I'm going to pass the mic, and the mic I'll pass it to.
Good.
So there is a field, and there are Black designers. So I would pass the mic to folks that are experts in Black-centered design, like the Creative Reaction Lab in St. Louis, who did pop up after Ferguson, and I think 2014, was it? You can start to think about that by Googling the Black Design Manifesto. So I am not gonna wade in on that answer, because I am not the one that should start that. Well, I can inspire perhaps some momentum to create that conversation, but I am not going to facilitate that conversation, because there are folks that can facilitate it, and I certainly am not going to offer answers in that case. But I can pass the mic and tell folks who are interested who to contact to get that design process going.
That's tremendous. Thank you so much for that. We're almost up on time. I want to let people know I'm talking with Scott Miles, and we're having a great COVID calls discussion today. And as I knew we would, we've ranged over many topics. I want to come back to something about trust, and it does come back also to this issue about boundaries. There's this sort of common lament that the public doesn't trust science. And I guess this is kind of a meta-narrative around climate change to a certain degree, although I know people who study emergency management feel the same, that, we have these great findings, can't get them out there, the public doesn't trust us. At the same time, scientists came to us in February and March and said, stay home. And most people did.
Yeah.
And many are still doing it. So I'm a little bit at cross purposes with myself right now and what this moment portends for science and thinking about disaster science. And I guess I want to ask you about this in your particular role. What can we be thinking about doing right now, again, to enter that space and say, yeah, we have information that you should trust. We're not taking a side per se, but we want to enter this space, and we want to be science communicators. Are there things that we can be doing right now to be doing that more effectively and enter this moment?
That was a lot. I think I haven't checked a poll for a little bit, but I think both absolutely and relatively, trust in science actually hasn't gone down that much. So when I mean relatively, specific to the pandemic, when they put compared to other, federal officials, governors, mayors, scientists are still polling pretty well, like Pew, when they've just generally done research about or is it I can't remember the organization, when they do general polling. It turns out that the public in general does trust scientists and science fairly well. So I think first is not to kind of overhype the issue. I think the other is, it gets back to the beginning of the conversation, is like, we have to interact with people as people. I don't think we can be like, hey, I know something really important that you should know. I don't know how that's ever going to work, no matter if you summarize it in a paragraph or you don't use jargon or what have you. I think you have to, like, in a genuine way, want to work with someone. And you might be thinking, well, how do you work with someone like in the media? Well, think about other like professions. That literally is what people do. I spent a decade like building a relationship with a Seattle Times reporter so that I could bring stories to her. She could talk to me off the record. I could talk to her off the record. We were working together because we did have common interests. Like, not all of our interests were the same, but we found interests that were common. And that's not easy to do. It takes time, but I think that's where you get success, where it's not just, oh, excuse me, I have something important to say, please listen to me and trust me. It's like you build the rapport and you're particularly working on something together. It might just be like quick interactions, but you're still trying to achieve a mutual goal.
So we're up on time. I just want to get one little quick question in here at the end. I don't know how much time you've had to participate in the hazards meeting, but I know you've scanned through the research agenda and things. What are maybe one or two ideas that are in discussion right now, something you've seen in a poster or presentation that's stuck with you right now in terms of what hazards researchers are generating right now this week, 2020, as part of the hazards workshop?
The first plenary this morning of hearing Indigenous voices, and like, I think of it as I didn't even try to articulate what they were talking about this morning, but there was like genuine concern of this idea of science being a religion, which, I mean, there's some aspects of that is not bad, but I think it's in the power dynamic that is created from that religiosity. And just listening to that conversation, for us to be intellectually humble and go like, oh, okay, like, here is how some communities, like, how we can join them, how we can like meet them where they are, rather than this one direction. If I can just figure out how to communicate this perfectly, people will listen to me and the world will be better. So I mean, that plenary to me was difficult, because they're like everything that got said, I wanted to write it down and I wanted to think about it. So I feel like I missed 75% of what they said, but that 25% for me was inspiring. And what great thing about it being virtual, it's all being recorded. So I certainly would recommend people watch that plenary. And I'll plug my own stuff. So talked a lot about human-centered design. So tomorrow, the first thing in the breakout sessions, we have a session on doing human-centered design for reducing hazard impacts and disaster risk. And then somehow I'm involved in 4 other panels, all relating to do with recovery. Yeah. Co-authors, man.
No, listen,
dude,
you got to do the Sunday opening stuff, and then that's all. Talk to me next time. That's a lot of work, but you have a lot of people working with you. And I want to remind people that we're talking about the hazards workshop, which runs out of the Natural Hazards Center, and you can participate in that workshop. People can still register and participate, or afterwards, certainly there'll be, if you just go to the Natural Hazards Center at the University of Colorado Boulder website, you can find connections to everything. And Lori Peak, who's the director there, has been a guest a couple times on COVID Calls. I want to remind people, you've been listening to COVID Calls, and tomorrow we'll have our second discussion with the Bill Anderson Fund Fellows. And I'm really excited to talk to Nancy Contreras and Antoine Richards tomorrow about racial justice and disaster research. Scott Miles, every time we talk, I come away like with a million new ideas. Thanks a lot for your time today.
Thank you. I really enjoyed this conversation.
Stay healthy, everyone. We'll see you tomorrow, 5 o'clock.